Hello, my name is Dongwoo Nam, and today I'll be speaking about the Korean medicine system as an independent medical system. This is a brief introduction of myself. My name is Dongwoo Nam, and I'm an associate professor at Kyung University, Korean Medicine College, and I have received Korean medicine doctor's degree, MS degree, and doctor's degree all at Kyung University. My clinical specialties are spine and joint diseases, and as for academic society activities, I am the Director of General Affairs at Society of Korean Oriental Medicine and Korean Medicine Spine and Joint Association, and also I am the Vice Chairman at the Korean Society of Acupuncture and Moxibustion Medicine. As some of you already know, in Korea we have a unique system where we have two medical systems coexisting. So we have the conventional Western medicine system and we have the Korean medicine system, which is based on the Korean traditional medicine. Well, the Korean traditional medicine has a different scientific approach compared to the conventional medicine. For example, if medicine emphasizes maybe lab findings or molecular changes and the cell level findings in the body, the Korean medicine emphasizes on the whole body as a whole. So we try to analyze the patient based on holistic ideas. So in Korean medicine, there are various diagnosis systems. For example, there will be the pattern identification system, which is similar to diagnosing various syndromes. If you have a combination of certain symptoms and you have a specific pulse, you would be diagnosed to a specific pattern. And another diagnosis system is a constitutional medicine diagnosis system. This would divide the patients into four typical types. So, according to which type of patient you are classified into, the diagnosis will be different for even the same symptoms. And also, there are other diagnosis tips which are based on the cause of the disease or maybe the normal health situation of the patient. Also, we have various interventions and treatment methods in Korean medicine. So, if conventional medicine is more standardized medicine, Korean medicine will be more tailor-made and patient-based medicine. So, who can practice Korean medicine? In Korea, we have 12 institutes which provide education for Korean medicine doctors. So, we have 11 private schools which have Korean medicine colleges in the universities, and we have one national university which has a graduate school program to provide Korean medicine education. So after you graduate from these institutes, you are able to take the national exam for licensure. So if you graduate from these colleges or the graduate school and then you pass the exam, you will obtain this certificate, which is a license for Korean medicine doctors. So from now, you can open your own clinic or you can be employed to Korean medicine hospitals or clinics. But if you would like to continue your study and become a specialist, you can continue your study at university hospitals. So we have a 1-year internship program and 3-year residency program for Korean medicine doctors who would like to specialize for specific majors. So there will be the internal medicine, gynecology, pediatrics, neuropsychology, acupuncture, moxibustion, ENT and dermatology, rehabilitation, and Sasan constitution. For me, I have majored acupuncture and moxibustion, so I am specialized for acupuncture and moxibustion. After you complete the internship program and the residency program, you will take in another national exam, and if you pass the test, you'll receive the following certificate. This is my certificate for the specialty of acupuncture and Moxibustion. So, what is Korean medicine? Well, Korean medicine is the traditional medicine system of Korea. It was influenced by the East Asian traditional medicine systems. It may share the roots with traditional Chinese medicine, TCM, or Indian traditional medicine, Japanese Kampo medicine, and all sorts of East Asian traditional medicines. But it has developed into a unique form, so it was more localized, and new methods or new diagnosis systems were developed. This is a representative text, a traditional text that Korean medicine is based on. Is called the Dongi-bogam. So this covers the whole Korean medicine system from the basic essentials and to the clinical prescriptions and so on. In Korea also we have a unique medicine system called the Sasang Constitution medicine, where we classify each patient into 4 typical types. So according to which type of person you are, the cause of each symptoms or cause of each disease will be different. So even if you have a same symptom, according to the constitution you belong to, the treatment will be different. Also, we have many traditional texts, ancient texts, telling us about localized herbs. So there will be local herbs that were abundant in Korea. So it was added to the whole traditional medicine system. So if we had a hard time obtaining certain herbs that were cited in traditional Chinese medicine texts, it would be localized and we would use local herbs. And acupuncture points also have developed into a unique system. So nowadays we compare TCM, Kampo, and Korean medicine. Maybe TCM emphasizes more on Western diagnosis and then Chinese treatment nowadays. And in Japan, the Kampo medicine, because it's practiced by Western doctors, maybe they emphasize on symptoms and they prescribe certain Kampo herbal medicines for each symptoms. But in Korean medicine, because we have a independent medical system just for traditional medicine, these doctors emphasize not only on treatment of the disease, but also of treatment of the body and the mind. So it may be more preventive medicine. And also because we cooperate with Western medicine doctors, and also in the education programs, we learn the Western medical subjects. It developed into a more integrative medicine. So what can Korean medicine doctors do? After we are licensed, because we have a independent medical system compared to the Western medical systems, we have different diagnosis devices and also intervention devices that we could use. So I will try to introduce to you some of the popular intervention tools. Well, the acupuncture is the most popular tool we use. We would stimulate acupuncture points or maybe muscles or skin surfaces with these acupuncture needles. Sometimes it penetrates shallow points, or sometimes it would go more deeper, depending on the situation of the disease or maybe the condition of the patients. In ancient times, there were 9 types of acupuncture needles, but nowadays, because we have separated the modern medicine and the Korean medicine system, we no longer need to do surgical procedures. So the modern medicine is very well developed in the surgery area. So Korean medicine doctors do not have to proceed with surgical methods. So this surgical mask-like acupunctures have been disappeared, And nowadays, new acupuncture needles have been developed based on these 9 acupuncture needles. And also, we use modern technology to develop new acupuncture types. Maybe one can be laser acupuncture, where we use laser to stimulate acupuncture points just as the acupuncture needle, but without penetrating the skin. Also, we have sticker acupunctures, which are very small acupuncture needles that we could put intradermally and stimulate the area for much longer time. Also, there are acupuncture needles, which are basically more thicker needles or mass-like needles. We could cut into shortened or thickened ligaments or soft tissues to stimulate the recovery process of the ligaments or soft tissues. And in Korea, pharmacopuncture is very popular in Korean medicine hospitals or clinics. So we would use various types of injections produced from various herbs. And in my clinic, I use a lot of bee venom acupuncture because bee venom is very effective for controlling inflammations and also controlling pain, and it also enhances the immune system. Also, in hospitals, you'll see that we use a lot of electrical acupuncture. In ancient times or in the past, the Korean medicine doctors would manually stimulate the acupunctures, but this takes a lot of efforts and it takes a lot of time, and also the stimulation wouldn't be standardized. So nowadays we use electrical stimulations, which will be more standardized and more efficient. This is one of the intradermal acupunctures I talked about before. So we would insert these intradermal needles to acupuncture points, and then the patient will leave the needles inside and stimulate the acupuncture needles every time they need to, and this will lengthen the stimulation of each acupuncture point. Also, we have a method called the fire acupuncture, where we would heat up the needle before inserting the acupuncture needles. This is very effective for controlling acute pain or inflammations and edema. Also, there is the warm needling technique, where we would insert acupuncture needles and apply Moxibustion at the same time. So the heat from the Moxibustion will go into the acupuncture point through the acupuncture needles. So this is more effective for chronic diseases or chronic pain and maybe malcirculation and so on. Also, we have acupressure devices where we would not penetrate the skin but just massage the acupuncture points. So if the patient is very afraid of acupuncture needles, or maybe the patients are very young or they are very weakened and they are elderly patients, we would use these to soften the stimulations. Also, we use a lot of bloodletting techniques for enhancing the circulation of the body. And this is a relatively new technique. We use the embedding therapy. In the past, they also used golden threads or maybe catgut to make the insertion, but the catgut had its own problems, and the gold threads, they would be left inside the body for a long time, and sometimes it would travel around and move to another body, so maybe injure the intestines or the organs of the body. So nowadays we tend to use these surgical threads. So these surgical threads are absorbed totally in about 2 or 3 months. So we could stimulate the acupuncture area for a longer time, but at the same time it would be relatively safe. This is the traditional Moxibustion types. We would burn moxas, so the heat from the burning and also the chemical effects of the moxa burn will help stimulate the circulation of the body and the recovery system. Also, it would act as an aromatherapy because the burning the moxa produces a very good scent, and it helps sedate the mind. Now, this is another popular intervention, the cupping therapy. We put it on the muscles so it could soothe in the muscles and lessen the pressures on the muscles. Also, Korean medicine doctors use a lot of herbal medicines. Basically, it's based on traditional Chinese medicine, but also it has developed into a more localized herbal medicine prescriptions. So we may prescribe herbal medicines according to which type of Sasan constitution the patients are in, or we would also use many various local herbs that are effective for certain diseases. And in the past, we used a lot of decoctions, which is like it looks somewhat like espresso or maybe a dark soup. But nowadays, also the form of the herbal medicines have been modernized. So we can use capsules or tablets and also powders and various types of Korean herbal medicines. Recently, we also use a lot of gel type herbal medicines, so it's more easy for the patients to take the medicine. Also, we use Chuna therapy, which is similar to the chiropractic. So we would modify the structure of the spine in order to treat the problems of the inner organs. Well, to give you an idea of what goes on in Korean medicine hospitals or maybe Korean medicine clinics, I would like to introduce to you what I do in my clinic. So when the patients visit my clinic, they will be interviewed. So medical history will be taken first, and then physical exams will be done. And after that, because we have Western hospital and Korean medicine hospital in the same facility, we would consult our Western doctors for X-ray tests, MRIs, and sonography or lab tests. And at the same time, we have various Korean medicine diagnosis devices we could use. So we would make Western medicine diagnosis and Korean medicine diagnosis at the same time to plan what kind of intervention we would apply to each patient. So we could pick from various interventions to which combination of intervention would be the most efficient combination for each patient. So we could consult with the patients, talk with the patient, interview the patients, and teach them what kind of interventions we can provide, and then we could make a model prescription for each patient. For the diagnosis, we use various Korean medicine devices. This is one example. It's called the Yangdorak, or the Japanese term will be Yodoraku, and maybe the Japanese term is more familiar for most of you. So it basically measures the electrical resistance of the skin on the 12 meridian points, which represent each meridian. So based on the findings, we would try to analyze the balance of the meridians. This is an example of the result sheets, and it shows the balance of the meridians based on the electrical resistance, and it also offers us a suggestion on what type of pattern identification this patient may be classified into. And sometimes it also suggests some acupuncture points we might use, or which meridian we should try to use during our treatment. So we emphasize the harmony of the body. So the balance is the main target of our treatment. So before we treat the patient, we would check the Yodoraku, and then after the treatment sessions are over, we can compare the results and how the balance has been normalized. This is another device called the pulse analyzer. Korean medicine doctors would take the pulse of patients with their fingertips to analyze which pattern identification these patients belong to. But it may be very subjective, and in order to visualize the results and make the results more standardized, we would use these devices. So as you can see in this result sheet, we can visualize the pulse to show to the patients, and the patient will have a more better understanding of how their body is working. So we would compare the results with a average pulse shape or a normal pulse shape. So for this patient, the pulse shape is okay, but maybe there's a rhythm problem in the pulse. So there may be a little malcirculation, and also the results will suggest which pattern we should diagnose this patient to. Also, we use a lot of digital infrared thermographic imaging devices. This detects the skin surface temperature. So we would compare the temperature of each area of the body. So if there is a very red spot or maybe a hot spot, it can mean that the muscle is very tense, or maybe there may be inflammations, or there can be pain points. So if the image is more blue or maybe purple and black, it may mean that it is very cold. So it may mean malcirculation and so on. This is an example of my patient. So you can see that this patient has a very stiff neck, and he has a pain point in his right cervical area, and also his back is very tense. So before we treat the patients, we would analyze the patients with these devices and show them which point we will be treating, and after the treatment we could compare the results. Also, as I mentioned before, we have a unique system of Sasan constitution, so we made it more objective. So we have these questionnaires where we can analyze each patient, so we can classify them into the 4 typical types where constitutions are applied. Also use Moire topography before we do the Chuna therapy or the chiropractic, so we could see the structure of the spine and also the balance of the muscles in the body structure. This is an example of a patient. He had scoliosis, so you can see that the height of the shoulders are different before treatment, and as you go to the right, you'll see that the patient was modified by using Chuna therapy and chiropractics and other Korean medicine treatments. Also, we have a concept called the blood stagnation, which is basically bad blood produced when the circulation is not good. So we would compare the blood pressures of the 4 limbs and also analyze the ECG to develop a result sheet for the blood stagnation and analysis. We also use Western medical examinations like the X-ray or the MRIs, and based on these findings, we would make a diagnosis based on Western and Korean medicine systems. So after that, we would try to explain to the patients about their diseases. First, we would explain to them what our specialties are at our center. So my center, we specialize for the spinal diseases. So we treat intervertebral disc herniations or spinal stenosis or scoliosis patients. So if you are one of these patients, you came to the right place, right? And we will show them the normal structure of the spine and their MRI findings. So if the spinal structure is normal, the body weight will be very even on the intervertebral disc. But if the spines are tilted, or maybe the body weight is overweighted, the intervertebral disc will be the pressure will be very increased. So the intervertebral disc will be pushed out, and it will stimulate the nervous system to produce pain. So in order to treat this condition, we would have two main targets. In the first stage, we would try to control the pain and control the inflammation of the area. So we use a lot of bee venom acupuncture, which is very effective for inflammations and also controlling pain. And after the pain is controlled, we will try to strengthen the muscles and ligaments so that the intervertebral disc will not be pressured anymore. So the muscles will bear the weight, so the weight won't be upon the intervertebral discs. We have various herbal medicines and also various acupuncture prescriptions that can strengthen the muscles. Sometimes we also use embedding therapy to strengthen the muscles. So for different targets of treatment, we use different interventions. For example, this patient needs pain control. So for pain control, we would use the traditional acupuncture and bee venom acupuncture to control the pain. Acupuncture already has been very recognized for pain-killing effects internationally, and also bee venom acupuncture has been studied for its anti-inflammation effects and pain-killing effects. In traditional Korean medicine, we have these meridians which represent each organs, and if there is a pain point on the acupuncture point, there may be problems in the internal organs, and maybe there will be malcirculation of the blood or malcirculation of the vital energy that causes the pain or causes the degenerative changes. So we will try to analyze the patient and find out which meridian is the problem. And sometimes we would try to find the tender points on the skin surface to recognize which acupuncture points we should choose when treating these patients. Bee venom acupuncture, as I introduced to you before, has anti-inflammation effects and enhancing immunity effects, and also it controls the nervous system and the hormone system of the body, and also has pain-killing effects. In traditional Korean medicine concepts, we say that bee venom acupuncture has the effects of Moxibustion and acupuncture and cupping at the same time. Because when you experience bee venom acupuncture, you'll feel heat, like burning sensations in the injection area. This is somewhat like the heat stimulation of the Moxibustion. And penetrating the skin and stimulating the acupuncture points is similar to the acupuncture stimulation of the acupuncture needle. And because it takes time for the bee venom injection to be absorbed in the body, there will be a lump on the injection site. So this will act as a pressure on the soft tissues, and this is somewhat like the pressure of the cupping therapy. So it has all three effects of Moxibustion acupuncture and cupping therapy at the same time. Also, electrical acupuncture is very famous for controlling pain. So it is also effective for paralysis patients, but for this patient, we would use this electrical acupuncture to stimulate the muscles to control the pain. Also, we would use these smokeless Moxibustion devices, which are somewhat like charcoal, so it doesn't produce that much smoke, but the heat stimulation is the same, and the chemical stimulation will be the same with the traditional Moxibustions. So we use these in our clinics. And also we have herbal medicines which have anti-inflammation effects and also pain controlling effects. So we would prescribe the patients with these herbal capsules that are made of urushiol, which is very effective for blood stagnation and inflammations and pain killing effects. This is an explanation and introduction of the urushiol capsule we use at our hospital. This capsule is also used not only for pain killing, but also for prevention of cancer and also controlling cancerous pain and so on. So the next target of the treatment would be maybe smoothing the muscles or strengthening the muscles. So traditional acupuncture applied on certain acupuncture points will be very effective in reducing the pain or the tension of the muscles. And sometimes, if the muscles are very weakened, the acupuncture needles will stimulate the recovery of the muscle, so it will gain strength to the muscles. Also, Moxibustion stimulates the circulation of the body, so the muscles will be more nourished, so the muscles can get stronger in chronic conditions. The cupping therapy also smoothens the muscles, so it can reduce the pressure or the tension of the muscles. Also, inpatients in our hospital, when they are hospitalized, they have a long time during the daytime. So we also have Tai Chi classes where they can do these Tai Chi exercises, which helps develop their muscles, which will help also control the pain and sedate the mind. As I introduced to you before, we also use these embedding therapies, which is basically surgical threads inserted into the muscle fibers. So the muscle fibers will be stimulated and the muscles will be strengthened. There are various sizes of embedding therapy needles, so you could use shorter ones for beginners, and if the patients get used to the embedding therapy, we could use more longer and more thicker needles for those patients. And you can see there are various lengths and various sizes. This is an example of how the embedding therapy needle are packed. They are all sterilized and they are all single use. And this is another image of how we use embedding therapy. So during the embedding therapy procedures, we can connect injections to the end of the embedding therapy needles to inject certain herbs. So the herbal medicines or injections will soak the surgical needle, so it will take a longer time for the injections to be absorbed into the body, so it will have a longer stimulation effect on the body. These are examples of how we set our embedding therapy. So for the spinal disease patients, our target of insertion will be the erector spinae muscles. So you can see we insert our embedding therapies in these areas. Maybe we would start with 6 embedding needles at the first session, and then at the next session maybe we could increase the needles to 9 and so on. So while these surgical threads are being absorbed to the body, it will act as a support of the muscle fibers, and it will also stimulate the growth of the muscles. These are examples of how we apply embedding therapies. And also, embedding therapy is very famous for cosmetic uses also. So in our hospital, there are doctors who use these embedding therapies for cosmetic uses also. And another target of treatment will be the ligaments. So to recover the elasticness of the ligaments, we would stretch the spine so that it will be more modelized. So we use these traction devices, and we also use the acupotomy needles to cut into the shortened and thickened ligaments. So the shortened and thickened ligaments will hold on to the vertebrae, so the pressure on the intervertebral disc will be very increased. So if we cut into those ligaments, the pressure on the intervertebral disc will be reduced, so the disc can recover to its own place. Also, another target of treatment will be the degeneration. So the degeneration of the bone, the degeneration of the joints, the degeneration of intervertebral discs and the muscles. We have various herbal medicines. This is one popular herbal medicine called 보골공진단, which helps strengthen the muscles and ligaments and also enhances your energy and nutrition of the body. And also we would prescribe tailor-made herbal prescriptions for each patient according to their constitution or maybe according to their various symptoms. The alignment of the spine is another target we have to treat. So we would use Chuna or chiropractics to modify the spinal structure. And after all this is done, if the patient is overweight, the weight will bear on the spines and the intervertebral disc. So we would have to teach the patients to lose their weight. So we have these herbal medicines that can help with their diet. So this herbal medicine basically stimulates the metabolism of the body. So it will be a hyper metabolic stage. So we will burn the fat from the body. And also it will enhance the circulation of the body, so it can heat up the body, so it will help for you to lose weight. Well, that is what goes on in my clinic. And in Korea, in some countries where you have acupuncture clinics or maybe traditional Chinese medicine clinics, they tend to treat all kinds of diseases. But in Korea, we have various specialized hospitals or specialized clinic for specific diseases. Because we have these specialty programs for 8 departments, there are specialists who are certified by the National Ministry of Wealth and Welfare. Some of the most popular centers are the Spine and Joint Center, because acupuncture and maybe Chuna is very effective for modifying the structure of the spine, and also it is very effective for controlling pain. We have different spine and joint centers and very famous hospitals which are specialized just for these diseases. These are some of the popular hospitals in Korea. Maybe you can visit later after we can visit Korea. Also, there are many facial palsy patients who seek treatment from Korean medicine, because the acupuncture stimulation shows very good effect in the recovery rates of facial palsies. Our hospital is also very famous for a facial palsy center, so they will receive bee venom acupuncture and traditional acupuncture and also electrical acupuncture and so on. And as you know, the President of the United States once experienced acupuncture in China for his stroke symptoms. The acupuncture was introduced to the Western society and became very famous. Also in Korea, Korean medicine treatment is very popular for stroke patients. So patients with sequela of stroke, or maybe chronic stroke patients with will be hospitalized in Korean medicine hospitals to rehabilitate with Korean medicine and Western medicine at the same time. Also, there are cancer centers where we have integrative medicine introduced to the medical society while they are being treated with chemotherapy or radiology therapy. They will take herbal medicines that can help reduce the side effects of these treatments, and then they would also be herbal medicines or Moxibustion treatments and acupuncture treatments for fast recovery after these treatments, and also prevention of reattacks of cancers. Also, there are infertility is a very big problem, and also in Korea. So we have many women's health centers where we prescribe herbal medicines that can help with the infertility situation, and also other gynecological problems for women. Also, because Korean parents are very competitive, they want their children to be good looking and very smart, and they can't lose to their friends. So, Growth Clinic is another popular clinic in Korea. They want their children to grow very high. So it mainly controls their diet and also stimulates the growth process of the students. If you visit the Gangnam area, you'll find many Korean medicine beauty clinics which have provide various natural treatments for beauty cosmetic purposes. Also, smoking of teenagers is a big issue in Korea. So some schools have these smoking cessation programs where they provide auricular acupuncture that can help the patients or students to quit smoking. So we basically insert intradermal acupuncture needles into acupuncture points on the ear, which will help sedate the cause smoking. And because Korean medicine is a big portion of the Korean medical system, we need to be controlled by the government and also by the insurance, the national insurance system, and so on. So we needed to standardize the Korean medical procedures, or maybe we needed a evidence-based analysis of the Korean traditional medicine. So now the government is supporting various development projects for clinical practice guidelines. So if you visit this internet site, you can find various CPGs concerning Korean traditional medicine. This is the address of the site, and you can see that about 106 CPGs have been developed, and they are introduced through these sites. So they also have a short English version, so maybe you could find the PDF files and find references for various diseases. Well, this is the end of my lecture, and I would like to thank you for your attention, and I would hope you are all safe and healthy, and that we overcome this COVID-19 pandemic situation. Thank you.